Skin. It's our largest organ. Most of us take it for granted and don't think twice about what life would be like without healthy skin that functions properly. But unfortunately, skin-related issues affect thousands of children and young adults with injured skin and deformities that present serious debilitating effects. What was once an idea is now a reality. Founded by Dr. Mark Ronert, Care for Skin Foundation was established in 2011 as a way to help support people who suffer a loss of skin. The goal of the nonprofit organization is to restore normal facial and body appearance and function with plastic and reconstructive techniques to those who cannot otherwise afford these types of surgeries. We help wherever skin assistance is needed, like in the form of skin transplantations, scar corrections, contraction releases, and other plastic surgery techniques. Partnering with like-minded individuals and organizations allows for the most impact to be made. The emotional, mental, and physical impact of burns is traumatic, more so than what most of us could ever imagine. An estimated 11 million people worldwide suffer from severe burns each year. Of these injuries, 95% occur in developing countries where the tools and treatments necessary to rectify the problem are not available. Often, these extreme burns and injuries can cause lifelong disfigurement, disability, and psychological stress. In some cases, disease and death are even in effect. In children, the impact is overwhelming and can lead to an inability to carry out basic daily functions like walking and writing, not to mention the embarrassment and social ostracization that these children and their families face. Another serious issue that children in underdeveloped countries face is cleft lip and cleft palate, also known as orofacial clefts, a birth defect that occurs due to the improper formation of tissue in a baby's lip or mouth during the 4th and 7th weeks of pregnancy. Both cleft lip and palate create an opening in the upper lip that extends up towards the nose. Children with cleft lip often have cleft palate, which is a lack of tissue in the roof of the mouth. Just like harrowing burns, cleft lip and palate create severe issues with eating and feeding, resulting in malnutrition. Speech problems, recurring ear infections, and dental and hearing issues are common of the condition and make basic communication difficult for children and for some impossible. In the United States, the CDC estimates that 2,650 babies are born with cleft palate and 4,400 babies are born with a cleft lip. But in developing countries, those numbers are much higher. Each year, Care for Skin's Medical Board of Advisors travel to third world countries to help patients in need of skin replacement. This year's mission is to Zimbabwe, where thousands of children suffer from either cleft lip or cleft palate. While the severity of a cleft can vary from child to child, the need for these surgeries is unquestionable, and the low-cost procedure can make a dramatic difference in a child's life. Over the past 7 years, Care for Skin Foundation has helped to improve the skin and lives of hundreds of people. These simple reconstructive surgical procedures are able to transform someone's life within just a few minutes, and to not offer this service to those in need would be unthinkable. Every dollar donated is used to help children and young adults in need, and if the smiles on these faces aren't enough to show the impact of how these procedures help, then maybe the drastic improvements in their skin do. Together, we can change a life.